Ayurveda in India today is one of the official systems of medicine, practiced all over the country at the official levels. We have in India around 300 Ayurvedic medical schools where we give training to new graduates through a 5.5 years of graduation course. Some of the institutions have postgraduate faculties where one can go for specialization for another 3 years of education in Ayurveda. And then we have in India around 500,000 registered practitioners who practice Ayurvedic medicine in different parts of the country. We have many hospitals and small dispensaries located in rural areas, and it is believed that the healthcare delivery system for the rural India is largely dependent on this kind of treatment. So it is an important healthcare system in India. And now the main emphasis that government of India is placing on the Ayurveda is to do research so that Ayurveda becomes a kind of evidence-based system of healthcare. This is considered to be important because unless there are evidences to support what we claim, probably it cannot be accepted outside India. And because of this, there is a trend of doing research, trying to evaluate the therapeutic modalities and also to evaluate the non-drug therapies of Ayurveda. This is the main theme which is going on. But in spite of this, the what kind of research is needed, what will be the approach of research in Ayurveda, what will be the real appropriate methodology of doing research in Ayurveda is still in debate, and people are still not very sure how to apply modern science to Ayurvedic approach, because Ayurveda and conventional modern science are very different in their approaches. Ayurveda is very pro nature, holistic system of medicine, whereas the modern biology and medicine are very reductionistic. They are very precise way of saying things in a analytical manner. So it is very difficult to adopt the conventional methods of research to Ayurvedic evaluation. So we are still standing in a crossroads. Some research is being done, but more than that, thoughts are going on how to evolve a strategy of developing evidence for Ayurveda through science, of course, but in a kind of positive, holistic manner. This whole science has to give a bent towards holisticity. Uh, Till recently, the word holism or holistic approach was not considered very scientific, but gradually this approach is being accepted as science, and the conventional science is trying to develop methodology for the study of holistic approach of healing. So this is the kind of thing which is happening gradually in India, and then there are a large number of Ayurvedic pharmacies, licensed pharmacies, who manufacture Ayurvedic formulations, mostly herbal formulations, and the number of such pharmacies has gone up to around 10,000 in different areas, and there is already a big market for such products inside India. There is also an avenues of selling these medicines outside India. So whole thing is growing fast, but there's a lot of input still required to give it a real shape so that it becomes a real mainstream medicine. In spite of everything, Ayurveda still is not the mainstream healthcare, and we are all pushing it hard so that it becomes accepted as a mainstream system of medicine in India, and maybe later also contributes something to the world medicine.